Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejo since time immemorial. UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, Twitter, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. Your facilitators today include our host, Erica Burrows-Girardi, with support from CHR&R Communications Specialist, Colleen Wick, and the Collaborative Learning Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation immediately after the webinar in our discussion group. Joanne Lee will be our lead facilitator. And watch for a chat from Colleen for details on how to join the group after the webinar.
Welcome to Engaging Policymakers for Healthier Communities. My name is Erica Burrows-Girardi. You hear regularly from us about how important it is to engage policymakers. We have also heard from you, though, that engaging policymakers is easier said than done. That's why we've produced this webinar to share practical tips on how to engage policymakers, but also address one more challenge that we've heard from you. Some health departments across the country have experienced decision-making authority shifts, but health departments still have a critical role to play in policy decisions. So we're going to dig into all of that today with today's webinar. CHR&R's webinars reflect the values we hold as part of University of Wisconsin Population Health Institute. Values of collaboration, integrity, excellence, innovation, inclusion, and courage. These are the values that we aim to model during the webinar, and we hope that you will too. And with that, I'd like to introduce you to the team that will aid in your learning experience today. Let's start with Joanne Lee with Healthy Places by Design. Hi, Joanne.
Hi, Erica, and hello to everybody in the audience. We have a very exciting webinar and great speakers lined up for you. But first, I want to tell you about one of the ways that you can engage during today's webinar. We invite you to join the conversation, and there's two ways to engage. The Q&A box is where you want to enter specific questions that you have for the speakers during today's webinar. We will try to answer as many questions as we can during the live webinar. However, please understand if we can't get to yours, or if there's a question that might involve a little more unpacking, feel free to join the post-webinar discussion group where we can discuss your questions with a little more time. I'm going to hand it over to Colleen Wick, who will tell you about another way to engage during today's webinar.
Hi, everyone. I'm Colleen. As Joanne said, I will be monitoring our chat. So please use the chat to share knowledge or respond to any questions we ask you during the webinar. And also, please make sure to join us in making the chat space welcoming by adhering to a few guidelines. So we like to use the chat to share successes, lessons learned, relevant resources, and links with your peers and colleagues. So please make sure to engage in a respectful dialogue. As you can see from the way the chat is going now, our chat conversations tend to be very engaging. So if it's too distracting, you could simply close out the chat window in Zoom. Also, one more note, please know that views expressed by speakers and participants are their own. They do not represent CHRNR or Healthy Places by Design. And again, remember to put those questions for the panelists in the Q&A box. And now I will pass it off to our technologist, James.
Thank you so much, Colleen. I'm James, and I am Program Technology Coordinator for County Health Rankings, and I want to be here to help make sure the webinar is a good experience for everybody. So if you have any issues, it's best to reach me through the Q&A pod as well, and Joanne can then assign questions to me to answer those. This is a great topic today, Erica. I'm so excited to be here, and I'll pass it back to you.
Thank you so much, James, and thanks to the entire production team. Many factors contribute to health and the conditions that shape thriving, healthy communities. Societal and political structures, systems, and policies, all influence and in many cases create environments that determine how long and how well people live. Throughout this year, we've been sharing that what we've been learning, and that's that healthy communities require everyone's input. Structural determinants like society's written and unwritten rules, policies, those practices, laws, even traditions influence whether we act together to benefit everyone's health and well being. And you know this, but people in groups who hold power form society's rules and determine whether they are applied in an equitable manner. So, leaving power in the hands of a few creates a path of advantage for some and a path of disadvantage for others. And it also depletes opportunities for good health for individuals, groups, communities, even entire regions of the country. Think of Appalachia, the Black Belt. In last month's webinar, we actually talked about how regions of the country experience persistent poverty. And many times it's because of those structural determinants. Everyone has a role to play, and everyone should have a role to play in creating society's rules and determining how they are applied. That means that I have a role, and that means that you have a role. Don't buy into the narrative that your voice does not make a difference because it does. All we need is opportunity and strategies to engage. We are fortunate to have two policy experts with us whose mission it is to help everyday people like you and me engage with policymakers. Join me in welcoming Keshia Pollack Porter. Keshia is the Bloomberg Centennial Professor and Bloomberg Centennial Chair of the Department of Health and Policy Management at the Johns Hopkins Bloomberg School of Public Health. And Blaire Bryant is the Legislative Director for Health at the National Association of Counties, or NACO as they call themselves. Welcome to you both.
Thank you, Erica, and good afternoon to all of our attendees. Thank you for having me.
Great, and good afternoon from me too. Hi, everyone. Thanks for having me, Erica. And I'm grateful to be here with Blaire. So looking forward to today's conversation.
Thank you so much. Yes, it's going to be a great conversation. And then after that conversation, we're going to have a discussion group that's going to follow the webinar so you can unpack what we talked about today. So please plan to continue the discussion with us. During the video intro, you heard about our discussion groups that follow the webinar. They're facilitated by Joanne Lee and are always very engaging and give you the opportunity to share with and learn from others. So Colleen will chat out the information at the end of the webinar so you can link to the discussion group. And one more thing I want to tell you about, look for today's resource guide, including links from CHRNR, links from our guests, and relevant links that are going to be shared with your peers or from your peers in today's discussion group. The resource guide will be emailed to you at the end of the week. You should already have access, though, to the webinar resource page that Colleen has texted in the chat. And with that, I would like to invite Keshia back.
I'm
Keshia,
back.
you co-authored with colleagues a very interesting guide, and it's called Policy Engagement, and it's designed for public health practitioners. Why did you and your colleagues create this guide?
Yeah, again, thanks, Erica, for having me today. This guide, this book, is a part of the Strategic Skills for Public Health Practice series from APHA Press. and the de Beaumont Foundation. The overall series was designed to support members of the workforce, of the public health workforce, in acquiring skills to help them leverage partnerships with other sectors and to be more impactful with their work. And I'll say what's exciting is that each volume of that skills series corresponds with one of the 9 strategic skills for public health practice. So the first book in the series was on community engagement, and we wrote the second one entitled Policy Engagement. And I want to lift up my colleagues, Shelley Hearn and Katrina Forrest, who are co-authors on the book. So that's about the series. But this book itself, we wrote this book because policy matters. And you talked about this in your opening comments. And oftentimes myself and my colleagues would get asked, how do you engage in policy? And we didn't really have a one-on-one to point people to. So we created this book to tell people how to engage, to describe why it matters. And quite frankly, we wanted to inspire people to get involved in policy. Because as you said earlier, we can't let a small group of people who hold power politically make decisions about us without us. And so we wanted to provide some foundational insights in a really easy to read way and to quell fears or apprehensions and ultimately motivate people to take action.
And I love the fact that you have all of these really, really practical chapters in the book. I've read it. The guide is a very good and easy read. And one thing that I thought was pretty cool is that you have these guiding principles about policy engagement. Can you share what those guiding principles are?
Absolutely. So as you see up here on this slide, there are 5 of them that are sort of these containers for the book that we lift up, and I'll briefly describe each of them. So the first is policy making is messy. So policy making is not neat and linear. It's cyclical, it's iterative with stops and starts. And we wanted to name this so that people don't get discouraged, particularly when you're working on an issue and maybe the momentum just stops because of some political forces external to your activities. And it's easy to think, well, that's it. Well, that's not it. Oftentimes things are a bill, for example, is proposed again, or maybe it is modified. But again, just wanted people to know the process is not a straight line. And we like to think of it as a little bit messy. The second principle that we lifted up is how you engage is personal. Engaging in policy can take a variety of forms, and the process itself provides critical opportunities to inform policy. And that can look like providing evidence-based recommendations, to collaborating with partners, to writing an op-ed. Again, there's no real wrong choice. I want to just say that. It's about doing what makes sense for your role and what you feel comfortable doing. And I want to lift up and emphasize all engagement is needed. We need to be involved. The third principle we put forward is lobbying is not a dirty word. And, people think, well, lobbying sort of conjures up this image of unsavory characters behaving in shady ways. And that negative perception it could be valid sometimes, but I do want to lift up that lobbying in and of itself helps advance causes. And there are people who lobby for funding for public health strategies, who lobby for prevention, who lobby for things that we care about. And though I want to acknowledge that there are many contextual and historical reasons that public health organizations, including governmental public health, fear or actively avoid lobbying. But lobbying is legal and it's an important lever for policy change. It's just important to know the rules about lobbying. And it's also important to know that you can absolutely advocate and educate, and we'll come back to that in a moment, I'm sure. The fourth principle we lifted up is understanding how your message and that your message should align with your target audience. And this highlights the importance of listening and understanding what the target audience, what those policymakers are saying, even people who are in opposition. Because what it can help us do is to inform our narrative and our framing around that issue we're working on. And finally, policymaking takes a village. Once we are clear on the problem that we want to solve and address, find your people. There are people we can work with in solidarity to address the issues we care about. And just know you do not have to do this work alone. Again, find your people, find that village.
Yeah, thank you so much for those unpacking what those principles are. I I love what you said about lobbying is not a dirty word. Those of us that are in the public sphere, we get scared, right?
Mhm.
But finding that village is one of the ways that you can leverage the relationships that they have and abilities that they have to be able to use lobbying as a strategy to move policy forward. So, the other thing I like what you said, Keisha, is making sure you understand even what the opposition says. Now, a lot of us don't want to listen to the opposition, but we have to be able to respond, right?
And to
So,
anticipate, right? Yeah,
yeah,
anticipate
and the
what
only
they
way
might
to
lift up.
exactly, and the only way to do that is to listen, and they want to be heard just like we want to be heard.
Yep.
So, um, what does it mean to approach policy with an equity lens?
I am a person who is a health equity scholar. I teach around health equity, do research in the space, and for me, and what we describe in the book is really the importance of an equity lens. And what this means is being intentional about analyzing the potentially harmful impacts of formulating policies, adopting policies, and implementing policies that continue to disproportionately or disadvantage underserved, marginalized, and racialized individuals and communities in order to name and ultimately reduce or eliminate those barriers to supporting equity. And in the book, we lift up a number of tools to help with this. We call out health impact assessments, or a tool that colleagues and I created called the legislative health note, or racial equity impact assessments. This image on the slide is just a reminder to think about putting on that equity lens and looking at policies, asking ourselves, will inequities be exacerbated, or will equity actually be advanced and achieved by this particular policy?
Yeah, that equity lens is so important. We're going to come back to that in a little bit because it's really important for us to think about when as we pursue policies, we want to be able to always make sure that everyone has the opportunity to have healthy choices, and that
Mhm.
means making sure that you operate with that equity lens. It's also important for us to remember to keep the social determinants in mind when talking to policymakers. Why is that?
I love this question, Erica. All of us here, and I'm going to collectively say us, are very familiar with why we need to focus on social determinants of health, structural drivers of health, and those root causes. But not all policymakers are there. I still have conversations with policymakers today, as recent as just a couple weeks ago, about health, and they automatically continue to focus on healthcare, right? Or they might say, oh, you're talking about insurance, or you're talking about the Affordable Care Act, or you're talking about Medicaid payments for state legislators. While that is all important, I say yes, and we need to get to these more upstream factors, these root causes, these social determinants of health, because it is so important, because we all know that the decisions made by these other sectors can have unintended yet anticipated consequences on health and health equity. And ultimately, our policymakers don't always think about those broader factors. And it's important for us to remind them of that, to spend some time educating and advocating about that as well, to help us achieve our goals.
Yeah, and that's in reminding them that whatever policies they're passing on education are so important to our health. And like you were saying, it's so much more than healthcare. Remember that we got to keep that in mind. Everything is health. Yeah. So there's
Absolutely.
one question that just plagues me and also plagues a lot of us in the audience because we grapple with this. I'm gonna just ask you because you are a policy expert, and is the question is, how can we build political will to address equity among policymakers? How do we do that? Because at the end of the day, I think that's the toughest thing to do is for them to even want to they may say they see the value, but then I sometimes feel like they just still don't value equity.
Yeah, and,
How do
and I
we
want to
do that?
acknowledge it is hard. It is hard.
Yeah.
And sometimes I feel like I'm pushing this big boulder up a hill, right? And it's
Mhm.
slow and it's a slog. But let me get back to the book, and then I'll say two things. One is the purpose of this book, which is calling for us to engage. And part of that engagement involves organizing, involves the power of people, which is real. And so I think about the importance of community power building and organizing, and yes, voting. Having our voices heard and knowing that our voices matter and our votes matter. And we can use voting to hold those individuals who are trying to hold that political power accountable. You know, I was on a panel recently, and one of the panelists talked about the work that we do to change policy as not being a sprint or a marathon, but a relay. And this framing has really stuck with me because I have always pretty much been in the camp of thinking about it as a relay, right? Like we have this, of a marathon. We have this long race to run. Policy change can take a long time. But this thought of a relay really gives me hope, because I think about how my ancestors, the trailblazers who were before me, worked to change the world. And progress was absolutely made, but we still have a long way to go. And so they passed the baton to myself and others to continue the work. And because we need to think about the long game for policy and focus on that long game, despite when it gets challenging, we have to keep our eyes on the prize and remain persistent. So this may mean that the change I'm seeking today may not be realized before I leave this earth, but I have to know that I can pass that baton to the people coming behind me, the people who are coming alongside of me and running with me. And that's community. And that's when I think about the importance of power and the importance of engaging so that our voices are heard.
Yeah, thank you so much for that. If you're interested in digging more into these steps, into the 5 principles that Keisha talked about, you can grab the book. She has a QR code here. Don't worry, it's in the slide handout. So I'm getting ready to switch the slide, but you can still look how use the slide handout to scan for the book. It is an amazing book. It's a quick read, but so impactful. And feel free to reach out to Keisha after the webinar with more questions, but we also are going to have questions for you at the end of the webinar. So thank you so much, Keisha.
You're welcome. Thanks, Erica.
And now Blaire. Thank you, Blaire, again for joining us today. The National Association of Counties, or NACO, is based in Washington, D.C. So who is NACO and what is your mission?
Thanks, Erica. And I'll just start by saying it's a pleasure to be here and such a pleasure to follow Dr. Pollack, just revolutionary thoughts and insights. So definitely a great pleasure to be here with all of you guys and share insights. So a little bit of background on NACO. We are the National Association of Counties, as you mentioned, and we're the only national membership organization that represents the interests of America's 3,069 counties. We serve nearly 40,000 elected officials and 3.6 million county employees. Our mission is to achieve healthy, vibrant, and safe counties across our nation. And we do this through really a twofold strategy. First, representation in Congress and with the administration that enriches the public's understanding of county governments and promotes exemplary county policies and practices. And then also, secondly, we strengthen communication and partnerships between county leaders that both fosters cross-sectoral collaboration and expands knowledge networks at the local level. So a twofold goal and mission statement there.
And in February, NACO released a report that was entitled County Role in Public Health. So what was the purpose, or what is the purpose of the report? Like, who's the audience and so forth?
Absolutely. So this kind of goes to the two goals that I mentioned of educating up and then also creating those partnerships at the local level. The county role in public health is truly meant to serve as a fundamental guide for decision makers at all levels of government, as well as public health stakeholders, to have more of a holistic picture of how county agencies are working together to protect resident health and well-being through the prevention of illness, injury, as well as other adverse health outcomes. Clear and defined narratives are an important part of advocacy. And as public health officials, we know that a robust public health system centers equity while also actively promoting the policies and systems and broader community conditions that drive optimal health. However, this can't be as a result of one single entity pushing this along. The work of public health is the intersectional and interwoven collaboration of local agencies, organizations, as well as community stakeholders. So this report can be leveraged to both outline and define local systems that advance public health and also help us to more effectively advocate at the federal level by telling our story.
Yeah, and that's why I wanted to get back to what Keshia was talking about, that village, that's part of creating policy. And the county is, and county officials, the departments is part of that village, and as well as sectors that make up like the public health ally network. So, what are those sectors, and how can public health build their network of allies so they have this village that Keisha is talking about?
Absolutely. So at the local level and specifically health and specifically foundational public health services are administered across many different governmental and organization sectors. As you can see on the screen here, counties typically serve as the system administrator for all of these sectors, whether that be through the local health department, through hospitals, nursing homes, or even our administration of Medicaid services. And since the US has a largely decentralized public health system, much of the responsibility for disease control and prevention falls on the state and local health department. But we know that local health departments aren't doing this work alone, but in partnership with many other agencies and organizations that make up the county public health system. So if we're talking about the local public health ally network, which really positions health departments at the center, it can be bucketed into key partnership categories, such as local government officials, policymakers, healthcare and mental health services providers, cross-sectoral partners, and key stakeholder individuals, as well as organizations. The role of local health departments in this schema is really as the convener and strategist for collaboration of all of these entities. And on the next slide, you can see kind of a chart that really encapsulates this.
Yeah. So all of these groups are part of that village. Yeah. So how can local public health systems leverage allyships to influence policy?
That is a great question. So given the role that we just outlined and the schema that we presented, we know that local health departments are really at the core of leveraging those partnerships and communications that build policy. And it may not be as inherent as one would think. It's not the same as lobbying, and advocacy and lobbying are two different things. And also influencing is another part of this. It's kind of a combination of building those partnerships to strategize on policy advancement. As representatives of local health departments and health facilities, there's tremendous potential for local health departments and local health professionals to influence policy. As mentioned previously, local health departments are truly the conveners and central element of our local public health ally network. And there are several key strategies in achieving public health to policy change. And the first is forming strategic partnerships. This means building collaborative networks with various stakeholders, including government agencies, nonprofits, all the bucketed agencies that we talked about previously, and promoting health initiatives as well as policy changes through these partnerships. We can also enhance public health outcomes by leveraging specialized knowledge and resources from various community entities, such as working with academic institutions to incorporate the latest research findings into policy development. And then furthermore, under this key strategy of partnerships, we can tackle public health issues more effectively by pooling resources that are both financial and human. An example of this could be joint funding initiatives for public health campaigns. So that's just a few ways that we can form strategic partnerships for policy advancement. The next strategy is to ensure that we have a seat at the decision-making table, and this is an important one. We must advocate for our involvement in policy discussions and decision-making processes. For instance, we can ensure public health representation on government advisory boards. In many communities, this is already happening. And having a seat at the table allows us to directly influence policy decisions and integrate health considerations into broader community policies. For example, we can contribute to the development of health-related legislation. This is an opportunity that we have when we're invited to the decision-making table. It's also important to build relationships with policymakers. So this should be kind of a core function of everyone's job, is to build those relationships with policymakers as well as stakeholders and decision makers, and ensure that ongoing engagement and influencing is occurring. Regular meetings with elected officials to discuss public health priorities is one way to do this. The third strategy is storytelling. And storytelling is a powerful but often overlooked strategy for policy advancement. We can certainly use the robust data for policy changes and demonstrating the impact of public health interventions. That's already happening. And we know that local public health is often the purveyor of local data, local health data that can really tell the story of effective initiatives. We can present statistical evidence to show effectiveness of vaccination programs as one example, and we saw that during the COVID-19 pandemic. The storytelling can also humanize the data and make it more relatable and impactful for policymakers and the public. As someone who is consistently interfacing with the federal government, it's not just the pure statistics that lawmakers are interested in. They're interested in knowing the full story, the names, the impacts. These are the stories that really drive policy change. And then the last strategy I'll talk about is speaking the same language as policymakers. So this is not to be underestimated by any means. We have to learn to use the language of policymakers to effectively communicate our needs and priorities. For instance, we can frame public health issues in terms of economic impact and cost savings. We know that at the federal level, economy and costs is really the driver in a lot of our policy decision making. So in whatever way possible, reframing our priorities in those terms will get us a long way. Clear, concise, and jargon-free communication is super essential when engaging with policymakers and with the public. And so when we're crafting our messages, not only crafting our messages to speak the language of policymakers, but also having targeted and clear messages for communities when we're relaying information about initiatives, particularly if that initiative is geared toward a certain sector of the population.
Yeah, such good information. And I love when you're talking about storytelling because, Keisha alluded to this. She was like, policy's personal. They want to hear that personal impact. And so important. The framing is so important, making sure that policymakers understand what that's money speaks, money talks. Talking like framing it from that economic standpoint, such good tips. Thank you so much. In the wake of the pandemic, we heard from some folks that are in public health that local public health authority shifted in some states. And in some cases, health departments have found that their authority is more restricted. So, how can health departments influence policy where there might be some constraints?
Absolutely. Well, first, local health departments get their authority and much of their funding from state and local governments. It's just the way that they're kind of established. State laws often dictate the responsibilities, funding, and scope of work for local health departments, as well as what resources are available to address the community's public health concerns. So the graph that you're currently seeing outlines the varying types of governance by state. So we have the lighter blue, which is referring to local governance structures. So that could be the county or the city government. And then the darker blue indicates state governance. So that is in states where the local health department is integrated into the state government. And then the kind of teal blue indicates shared governance structure. So that means in some counties, it's run by the state. Some counties, it's run by the county or the local government, or it's a mixture of both. And then the last gray section refers to a mixed governance structure. So really across the state, it's mixed between county and state government. So with that, on the next slide here, I wanted to talk a little bit about how the structure of local public health authority has both opportunities and challenges for advancing policy. The opportunity really lays in the fact that the great majority of local health departments function as a unit of local government, positioning them well to partner with policymakers on decisions that influence the health and well-being of local residents. Each type of governance structure that we went over has its own unique advantages and strategies for policy advancement. For example, a local governance structure where the county or the city government is the driving force, you have the opportunity to partner with county officials as well as county and local government agencies on direct decision making. So we know that a lot of our policy decision making is locally based. And so in a lot of our initiatives and the groundwork on those initiatives are locally based. So partnering with county officials on public health initiatives is a key opportunity for those local health departments that are integrated into the county government structure. And the more localized you are, the more personalized you can get with building out public health initiatives. The state governance structure has the opportunity for more interface with state level policymakers, which can be good because at the state level, we're thinking about things like Medicaid as well as other kind of broader decision making. And so when the local health department is integrated with state policy decision makers, you have more control over the services and funding that you receive, particularly if you're building those partnerships and making the case for some of your local initiatives. In shared governance structure, there is an opportunity for integration with both the state and county infrastructures and the opportunity to build partnerships at all forms of local government. So we're talking more localized initiatives with county and city governments, but also state partnerships and collaborations that help to bring in funding and give us greater control over decision making. So that opportunity lies in both ways. In a mixed governance structure, there is an opportunity for cross-jurisdictional partnerships. So, for example, if I'm in a county that has a county governance or local governance structure, but the county across from me has a state governance structure, there's an opportunity to partner with that county to really advance some of our public health priorities. And with us having different governance structure, we can influence up as well as influence down. So that's the opportunity there.
Go ahead, Blaire.
I was just going to say one persistent challenge that I wanted to acknowledge here, of course, is the shifting landscape of authority since the onset of the COVID-19 pandemic. And you alluded to this in your question. This has been become increasingly limited by local legislation, the Public Health Authority, and the need for renewed partnership and engagement with local policymakers, as well as database storytelling, has never been more important in this landscape.
Yeah, absolutely. And I love the fact that you've broken it out. So, because the bottom line is there's going to be an opportunity. There's opportunity no matter what the constraints have been. And thank you for pointing out how it is so important right now that public health departments lean into their superpower, which is the data and the stories. So thank you for sharing that. And with that, can you share a couple of examples of how public health has worked cooperatively with, county governments to design equitable policy?
Absolutely. So I wanted to share two quick examples, really good examples of counties that are leveraging partnerships, leveraging data to really kind of move the needle in public health initiatives as well as policy. The first example I'll share is coming out of Baltimore County, Maryland, and it's based around the COVID-19 mobile operations outreach vehicle, which they affectionately termed MOVE. And it's a great example of local cross-sectoral partnerships. This initiative was again launched in Baltimore County, and the goal was to increase vaccination rates in under-vaccinated areas of the county. The MOVE initiative involved forming strategic partnerships with various stakeholders that included the government agencies, but nonprofits, private sectors, and community organizations as well. The county created what they called strike teams and designed a custom truck that they dubbed the MOVE to reach some of the hot spots and identify through data analysis which locations they needed to go to. And these locations were typically not suitable for larger vaccination efforts, but could accommodate a small mobile strike team. The MOVE initiative also exemplifies the power of data in guiding public health interventions, as the county's data team mapped out the hotspots, as I mentioned, down to the street level, identifying potential sites for the MOVE vehicle. This data-driven approach ensured that resources were effectively directed where they were most needed. The initiative also truly demonstrates how local health departments can leverage cross-sectoral partnerships, strategic planning, and data-driven decision-making to address public health challenges effectively, and serves as a model for other communities. The other example I wanted to highlight is the Cook County Housing is Health Medical Respite Center, which was opened in December 2020 through a partnership between Cook County Health and an initiative called Housing Forward there in Cook County. Funding was provided by County Care, Cook County Health's health plan, and the Cook County Bureau of Economic Development. The center caters to patients that are experiencing housing insecurity as a social determinant of health and in need of a safe place to recover following a hospital stay. Referrals came from the Cook County hospitals, Cook County health facilities, or other qualifying individuals from the Cook County jail. So really kind of a cross-sectoral partnership for identifying individuals in need. Since it's open, the Respite Center has provided recuperative care for more than 70 patients, including small families who would otherwise be discharged from the hospital to a shelter or another sort of unstable living condition. So the center recognizes that to truly achieve health equity in Cook County, healthcare needs to be looked at beyond just treating people within the four walls of a clinic or a hospital or even a jail. And that through partnerships with community agencies like Housing Forward, they've created safe and comfortable spaces for patients to recover from illness and a pathway from homelessness to permanent housing. So really the county is demonstrating here how local health departments can leverage, again, cross-sectoral partnerships, strategic planning, and data-driven decision-making to address public health challenges.
Yeah, great examples. And I would love to hear from our audience about how you have partnered with your counties or maybe other counties. Like Blair said, you don't have to, there's ways you can leverage the connections that other counties have with policymakers. So I would love to hear that. You can put some of the examples in the chat about some of the things that you've done, or better yet, come to the discussion group to share with Blair and Keisha and the rest of us some of the work that you've been doing around policy at the local level. Thank you so much, Blair. We'll come to you in just a second with some questions. But as you heard Blair describe, public health and government can and actually should work together to develop policies that improve health for all. So, here are two tools to help you move forward that you can find on our website. What Works for Health is an online tool where you can find policies, example policies, programs, and systems, changes that affect the factors that we know that make communities healthier places. Like Blair was talking about housing, we talked about education as well. We have over 400 policies and programs in What Works for Health, so you can actually check those out. They're all evidence rated, and a third of those policies actually have an equity analysis. Now, you heard Keisha talk about the importance of using an equity lens to examine policy. So, like I said, we've got a third of our What Works for Health 400 strategies that offer that equity analysis. And the analysis consists of these four elements. So, be sure to check out the webinar resource guide that I told you about earlier that we will email you for more information about the analysis and how you can use it. The last tool I want to share with you is our congressional district maps. Now, this is another helpful way that you can actually have conversations with policymakers because we know that place can be a strong predictor of health, and maps are a powerful way to view spatial patterns and health factors and outcomes across the state. It's another way of displaying data. So, our interactive congressional district maps is one way that you can educate elected officials about health in their districts. The maps can be a great tool when advocating for health departments for health improvement rather for all, and they are available on the state health snapshots. So I wanted to give a big plug for our congressional district maps because I'm not sure how many of you know, but they, know about them, but they're there. So please reach out to us for assistance if you need assistance in locating them and actually using this tool. I really would love for you all to check out this tool. And so with that, I'm going to pause and ask Joanne to come to the mic and see what questions have been bubbling up.
Thanks, Erica. And yes, and I welcome Blair and Dr. Keshia to come back because we have lots of questions. And I do have to admit, there are lots of folks, Erica, to your point, in our audience who have been sharing their own experience around engaging policymakers. So I hope they do come to the discussion group because we want to hear some of those community examples. But lots of questions for our speakers. And I'm going to start with Dr. Keshia first. So Elizabeth submitted a question, and first just had lots of appreciation for you and the work that you're doing in this field and how important it is for practitioners. But Keshia had a really good question about sort of the tightrope that many of us need to walk in balancing the fact that a lot of the work that we do around this is professional with a professional hat, yet policymaking often needs to be conducted on personal time. Can you speak just a little bit more about how practitioners can kind of do that balancing act?
Yeah, thank you, Joanne. And Elizabeth, great to see your words here. Thanks for being on today. I want to pick up on a point that Blair said and reminded everybody about the importance of advocating and education. And I want to just first of all acknowledge your point, right? Yes, there's often trade-offs in terms of how do we spend our time and how do we ensure that our policy work can actually align with our jobs. Well, I'm going to give you an example. So I have a colleague who had reached out for some support on a policy issue and sort of mentioned a tension similar to what you've named in your question. And we talked about how, they're expected to engage in an area which clearly needs policy solutions to actually move the needle, and talked about how that wasn't their exact scope of work. And so we talked about, well, where are the places to leverage partnerships, as Blair talked about, or some of the work in the advocacy or in coalition building or community outreach and engagement that they did have time to spend on, that was part of their scope of work, and how do we actually find those policy solutions, right? So yeah, sometimes, I get involved in activities that are outside of my job and my own personal interest. And I'm not even referring to that because there's only so many hours a day that we can work, but where we can make those connections, where we can talk about leveraging what we already have in place, partnerships, existing projects where we can bring in that policy lens. And it's not just about, again, that direct engagement with policymakers, but the research, pulling together the data, writing the brief. Some of these other activities are all part of the policy process. And for many of us, and I suspect many of you on this webinar, those tactics and those activities can fit within your job. And I would just say, think about those roles and how you can make that case for how to have it be part of what you do day to day.
Mm-hmm. And I think you also pointed out the fact that as citizens, we don't have to use our professional language, but we can still talk about similar issues, right? As a citizen. And it won't,
Absolutely.
yeah.
Absolutely,
Thank you.
Joanne. I mean, I am a resident of the state of Maryland, and I go testify in our state General Assembly. And when I go, there are times when I go as a citizen, and I'm speaking on behalf of myself, and I name that disclaimer when I provide comments. And there are times where actually I get invited to speak as a public health professional, and I get and then I get cleared and checked in with my institution, right? But I'm always able to do this as a citizen, and to go and speak and to, again, have that disclaimer. And it's just important to know the rules.
Right. Right. Thank you. That was helpful. So I'm going to turn to you, Blaire. You specifically talked about the value of storytelling. And I think many of the practitioners know that that's just so powerful. You know, you can have data, but also the storytelling is what really moves hearts. And so Kanitha, I'm sorry if I mispronounced your name, but really picked up on this and also recognized the value of having the stories be told of the people who are affected the most, right, with policymakers. But do you have any tips for how to do that when perhaps we're not speaking policymaker-ese or using the same terms, or it might be difficult because the policymakers have very different lived experiences? Just some storytelling tips.
Absolutely. I think that that is a phenomenal question, and it's certainly something that is a delicate balance, and it's a part of advocacy, is learning how to storytell in a way in which you're speaking the same language as the person you're telling the story to. And I would say for federal policymakers, whenever we're in their office, particularly if you are a constituent of that policymaker, having a story that is relevant, and not necessarily having to speak public health ease or even policymaker ease, but here's how this particular policy is impacting me. I'm a constituent of your jurisdiction. And here is how it impacts my broader community, my family, my neighbors, et cetera. I think that is the compelling piece. Even if that person doesn't necessarily have the same political lens as you, everybody can relate to what's going on in their neighborhood. Everybody can relate to what's going on in their community. So whether or not you share the same political views is irrelevant when you're talking about your community. And I will tell you that policymakers really do care about their constituents. A lot of the times we go in behalf of counties and county officials and try to tell their story, but nothing is as effective as a county official, a county resident, a county worker going into their office and saying, I work for the county health department, I work for the hospital, I'm a firefighter, and this policy is going to do us good in X, Y, and Z ways, or it's doing us damage in X, Y, and Z ways. And that translates most of the time, 90% of the time.
That is so helpful to really put the story within the context and the policy within the context of the specific community and the constituents. Because you're right, that's what policymakers track, because that's what gets them elected, right? Very helpful. So the next question, I think audience would love to hear from both of you on this, and it speaks to how do we make sure that all of our efforts are done with an equity lens? And a couple of audience members pointed out the fact that when we just use that term equity, which is seen differently from the use of the term equality and other terms, that immediately it becomes politically divisive. So what are your thoughts as we try to engage policymakers who are almost starting to shy away from the use of that term? They may not, they may be totally on board with the concepts, but just do you have any tips around the equity lens and some of the misuse and uses of the term? And I'll start with Dr. Keshia.
Sorry, my screen moved. This is such an important question, particularly, I know I talk to people who say to me, I'm in places where I can't use the word racism. I can't use the word health equity. How do I still achieve this goal? And I lift up what Blaire was talking about in terms of narrative and storytelling, and framing and understanding what are the ways that resonate. The other thing I think is important to name is when we think about an equity lens, for me, that's also ensuring that community is at the table with me. And so how do we lift up voices and center voices of people who may not be at the table, who may be at the margins? How do we help to have them be part of those conversations? One example is, I know I've gone to do visits with legislators, with members of the community, and we both can actually bring our own experiences and our own journeys and our own stories, where I can think of a perfect example where I was bringing the data on an issue and I was paired with somebody who was able to say, yeah, here's the data in our district, and here's my story. And how do we help to lift up and share those experiences? And so that's just one way. Another way, when I sort of think about that equity lens and the tools we've talked about, is how do we actually do an analysis and lift up the various ways of how fairness, right? When we think about equity, we're talking about social justice and fairness, and how do we actually describe those ways and use the data to show the differences and show the intersection of differences by race, by gender, by geography. And I've learned that actually bringing those data at that local level, I love that Erica showed the congressional map tool. For those of you who haven't looked at data at that level, really do that. Because you can see those differences. And to your point, Joanne, it's not about looking at equality versus equity. It's saying, yes, here are the differences, but why are those differences? What are the underlying root causes that are driving those differences? And so I've learned over the years to really sort of be careful and mindful of how I'm talking about the issue, so I don't turn somebody off, but I'm still able to effectively communicate the points at hand. And I would say some intention and understanding your audience to get to some of the points Blaire mentioned is so critical here. And I'll turn to Blaire to add there.
Yeah, absolutely. I am happy to kind of just really put a fine point of all that you said, Dr. Pollack Porter, on really having a distinction between what you mean with equity and distinguishing it from equality. So when we talk to congressional officials or federal officials, it's often helpful to really define what you mean when you're talking about equity. And it can sometimes be circumstantial. So when I'm talking about equity with regards to an initiative on public health or behavioral health, I'm not referring to the fact that I'm assuming everybody will have the same health outcome. Everybody will have reduced blood pressure when we initiate this particular program. That's not what we're referring to. We're not referring to equality in health outcomes. But what we are referring to is the equalized ability to access services that will give them a better shot at an improved health outcome. And typically that can be something that is well defined based on the scenario in which you're referencing when you're talking to the elected official. So when I would say it's circumstantial based on the particular viewpoint and the person that you're talking to and the initiative you're talking about, and defining that will level set. So, and it will also help you to avoid getting into partisan politics.
Right.
Because when we use general terms, people have their own assessment of what equality means and what equity is. So having that level set conversation, we are hoping to do this initiative and enhance equity by giving everybody an equal shot at access to services that will improve their health outcomes. That kind of diffuses the situation and gives a better understanding and more context to what you're referring to.
Thank you. So Erica has come back letting me know we've run out of time for the live Q&A, but there's many more great questions that the audience has posed. So I really hope you all join us in the post-webinar discussion group. Both Blaire and Dr. Keshia will be joining us. But Erica, I will turn it back to you right now.
Yeah, thank you. Thank you so much. This is such a great discussion that's already started. It's like a preview to the discussion group. So Love it. Colleen sharing out a link to our web feedback survey. So please take a moment to save that survey and fill it out later. And I want to give you a preview about what's happening next month. You know, communities and individuals exposed to policing practices as described as, like aggressive, can experience negative mental distress and poor physical health. So you heard Keisha talk about the role of organizing for policy change, right? Next month, we're going to hear from two organizers working to improve approaches to policing and incarceration. Christine Mitchell and Mark Rice will be here joining us to talk about approaches to policing. Mark's going to share his personal story. It's going to be amazing. So be sure to register for that webinar today. And I will give you a hint about September. We normally don't do this, but storytelling kept coming up. In September, we will be having a webinar that's going to talk about storytelling as a strategy. So make sure that you plan to join us in September as well. So we've been telling you about this discussion group. Please do join us if you can. These discussion groups are amazing. And Keisha and Blaire will be joining us, and Colleen is chatting out a link so you can register for that discussion group and join us right now. Lastly, I want to say stay in touch with us, folks. We have lots of ways to remain connected. The best way is through our newsletter. So make sure you subscribe to us. But we also have a presence on social media. So thank you to Dr. Keshia Pollack Porter and Blaire Bryant for sharing their wisdom with us today. Thank you for all that you do to promote and advance equity in the communities you live in. And I will see you next month. Have a good afternoon.